If you want to shine like a sun, burn like a sun first, said our former president, Dr. APJ Abdul Kalam. Good evening, one and all present here. On behalf of Holistic Wellbeing League and Social Works League, I feel extremely delighted to thank the management for permitting us to conduct this COVID awareness program. I'm very happy to welcome our principal, Dr. Tirumadi S. Kodai ma'am, our vice principals, Dr. Usha Rani Aided and Dr. Usha Priya Self-Supporting. I take this opportunity to welcome our Dean of Students, Dr. Mrs. T. Punitavadi Aided and Dr. Mrs. Anusha Balasin Self-Supporting. I also welcome all the heads of the department, staff members, and all the participants to the webinar session on fighting COVID-19. I cordially welcome our chief guest and speaker of the day, Dr. R. Madhumita. Ma'am has completed MBBS, Diploma in Family Medicine, RCGP, UK, DNB on General Medicine, and FNB on Infectious Disease. Ma'am is now a consultant in infectious disease at Capstone Clinic. Madam is also a consultant in the Department of Infectious Disease at Apollo Hospital, Chennai. Dr. Madhumita's extensive training in the field of infectious disease has helped ma'am to achieve remarkable expertise in the areas of diagnosis, evaluation, treatment, and management for a multitude of infectious caused by bacteria, fungi, virus, and parasites. Ma'am believes that infectious disease physicians are in fact the detective of modern day medical care, as they can help in providing solutions to multitude of patient syndromes. Ma'am strongly feels that responsible doctors and improved awareness among the patients are the need of the hour. Ethical medical practice with a focus on multi-speciality family care delivered by caring doctors is what ignites ma'am's passion. And this is why the mission and the vision of the Capstone Clinic touch a chord in her. We welcome you to this session, ma'am. Last but not the least, I heartily welcome all the participants to the webinar session. Thank you. The
Thank you so much.
participants are requested to be in mute and can comment their questions and doubts in the chat box. Thank you, ma'am.
Thank you so much for the introduction. Thanks, Dr. Punita, for calling me for this. And it's a great opportunity to talk to young minds, because if you touch the chord with them, I feel they will start spreading the right message, right? Okay. So good evening, namaste, vanakkam, and I believe that at the moment, disseminating the right information is the best way to fighting COVID. Before I talk about COVID, all my infographics are from known sources like the World Health Organization, Center for Disease Control, Ministry of Health and Family Welfare of India. Before we talk about COVID, let's talk about some pandemics in the past. The 20th century, we saw a Spanish flu, which lasted almost for 2 years, killing about 50 million people. In the 21st century, all of you might have seen the swine flu going on around for 1.5 years, killing about 3 lakhs people. And now swine flu is endemic. We have it throughout the year in many parts of the country. 2019, December, we had a new wave, the COVID-19. Right now, there are 141 million cases all over the world, with 3 million deaths. So what is this coronavirus? Is it something new? I don't think it is new, because we've had many pandemics in the past because of coronavirus. Way back in 1960, there were few small cases reported. In 2002, we saw the SARS-CoV, or the SARS infection, which originated in China, killing about 774 people all across the world. In 2013, we saw MERS-CoV, which is basically the Middle East Respiratory Syndrome virus. The death in November 2018 was 858, and MERS-CoV continues to be a problem in the Middle East. It originated in Saudi. And in 2019, in December, we had another China virus, which continues to create havoc all over the world in the last 1.5 years. How did this word COVID-19 come? So the first 2 letters of corona, first 2 letters of virus, and the first letter of D. They clubbed it together and made it COVID. And since it originated in 2019, so they gave the number 19. What's the story so far? I'm sure all of you would have heard, and this is just a revision of what we heard so far. 31st December, China reported a new pneumonia that was happening in multiple people. 11th Jan, China reported, okay. So the disease so far. So this is what I was talking about. How did COVID get its name? So CO from corona, VI from the virus, and D from the disease. And since it was detected in 2019, the 19 number was added to it. What's the story in India? So we had our first positive case reported from Kerala, from a girl returning from Wuhan. So the first positive case was detected in Jan 2020, 30th Jan 2020. Soon we had a lot of cases all over. In September 15th, we had a highest number of highest number of deaths in a single day, 1,290. And the maximum number of cases in a single day was 97,000 in September 16th. Vaccination, the largest vaccination drive began on Jan 16, 2021. What happened after that? We continue to have a large spike. So my slide is going to be on this: who, what, when, where, why, and how. Not where, but which. So let's start. What are the COVID-19 symptoms? Right now, any symptom is COVID until and unless proven otherwise. So you have fever or only chills or muscle pain, body ache, vomiting, diarrhea, loss of smell, any cough, any shortness of breath, please get tested. We always attribute our symptoms to eating ice creams the previous day or a hair wash, or no, I just had some chills because I put on the AC. We deny the fact that this could be COVID. Please get yourself checked if you have any of these symptoms. Who and when to test? Anybody who has a symptom? Others who have been in close contact with somebody who is tested positive. Even a 15 minutes close contact with somebody who is tested positive without a mask is good enough to be defined as a close contact. So please get tested. A large gathering in an indoor settings, there are a lot of weddings happening. One person in the wedding is positive, the entire lot gets infected. This virus right now that we are seeing is a very infectious virus. So it spreads before you even realize that the entire family is affected. Which test to do? We have two tests actually, the antigen test and the RT-PCR. Right now, the antigen test is not being done in many places. What we do is the RT-PCR, which is just, they take a swab, put it in your nose and do a molecular test on it. The turnaround time is 24 hours. So if you have any symptoms and you want to find out that you have COVID, get the RT-PCR test done. Many of us would have heard about the antibody test. The antibody test is not to be done when you have an acute illness. The antibody test is only to find out if you were exposed in the past and you developed antibody because of a past COVID infection or vaccination. What do you do if you get tested positive for COVID-19? Stay home. Do not panic. Rest, 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 rest. Hydrate yourself. I always tell my patients every 2 hours, drink something. Keep drinking something. Anything is okay. Even buttermilk. The first question I'm asked is, buttermilk sapalama, juice sapalama? Yes, in room temperature, you can continue to have. Third, keep in touch with your doctor. Inform your doctor about your symptoms. Jot down your symptoms. All that you need to do is two things. One, keep checking your temperature. 3, monitor your saturations. I always tell, The way you have rice and dal at home, right now, the need of hour is a pulse oximeter and a digital thermometer. You have to invest on this. Every household has to have this, a pulse oximeter and a digital thermometer. Third, separate yourself. The minute you realize that you have symptoms, please stay away from others in the house. Once you get tested positive, yes, the corporation will come, stick a notice outside your house saying that you're supposed to stay in for the next 14 days. How do you home quarantine? Yes, stay in a ventilated room, stay away from people, restrict movement within the house, do not go out, wash your hands repeatedly, avoid sharing your items with the rest in the house. You need to have your separate plate and spoon and cup. Your food will be served outside your door. Pick it up, eat it, wash it, and keep it inside with you itself. Wear a surgical mask when you have to come out to pick your food. Otherwise, inside the room, if you are alone, you don't have to wear it. Please dispose of your mask properly. Fifth, keep in touch with your doctor. There are two words that you need to understand. What is a quarantine and what is an isolation? Many people get confused with these two words. Isolation is actually, if you are infected, you are isolated in a room. You stay separate. That usually we define as 10 days from the day you tested, you had your first symptom. Okay, so from the first day that you had symptoms, you need to get yourself isolated for the next 10 days. Quarantine, that we say 14 days stay in one place itself, is basically for the family. Now, what problem I see right now is the entire family will get tested, but 2 or 3 of them are negative. So what they do is take those 2, 3 of them and send them to somebody else's house. No, you shouldn't be doing that. All the members of that family stay in the same place. The one who has got symptoms isolates himself in a separate room. If there are 2 or 3 people positive, all those 2, 3 people can stay in the same room. The rest of them stay separately, because for the rest of them, the next 14 days, you need to monitor your symptom. You may get fever, you may get cold, you may get cough anytime later. You may have tested early in the illness, so your test could be negative. So do not step out of the house if the family doesn't step out, even if one person in the family turns positive. So what are the 10 best things to do when you test positive? Stay home in a separate room, get rest, stay hydrated, do not self-medicate. Please get in touch with your physician and follow the prescription. Monitor your symptoms. Stay in touch with the doctor. Stay away from people who give you free advice. You don't need any free advice. Your doctor is there to give you advice. Avoid sharing personal household items. Clean your hands often. Watch Netflix, Amazon Prime, or Hotstar. Stay positive. Why? What am I saying? Stay positive. Stay positive in mind. Keep thinking, yes, I'm going to fight this virus. Because if you continue to watch media, news, all that is going to cause too much of negative thoughts. Don't do it. What are the emergency warning signs when you need to get admitted? You have your oxygen level dropping less than 95, persistently below 95. You need to get admitted immediately. You have trouble in breathing. There's persistent pain or pressure in the chest. There's some confusion, bad headache, fever beyond 8 days. Your lip, skin turns blue. You need to get admitted. So about the virus, infectivity, when does it start? In fact, the virus is infectious 2 days before appearance of symptoms. So even before you know that you have symptoms, you will start infecting people. When does it end? Generally, we say a period of 10 days. Beyond 14 days, the virus is not viable. And retesting. Please don't get this negative test. Everyone asks me, like, doctor, after 14 days, can we do the retest? Please don't do retesting. Retesting or RT-PCR is not recommended. because the PCR will not be able to differentiate between a live virus and a dead virus. So even a dead virus, which may be there in your throat, will be picked up by the PCR. Recurrence of infection, possible. If you don't wear your mask, you can get infected again. Once infected, your immunity may protect you for the next 3 months, but we still do not know how long this protection lasts. If you don't wear a mask, yes, you can get reinfected. What if the symptom settles in a day? Very good. Your symptom settled in a day, but you still continue to isolate for the next 10 days because your symptoms may settle, but you continue to spread the virus for at least 10 days. When do you admit? I told you when to admit and where to admit. Unfortunately, right now, with the shortage of bed, I would say wherever you get a bed, get admitted. When will we have a cure? Unfortunately, we have not found the cure yet. All pharma companies come with a lot of medications, but currently there is nothing specific for COVID. What if you test negative? As I said, it could be very early in the disease that you tested, so you could be negative. 2, maybe in the next couple of days, you may fall sick. At that time, you need to do. 3rd, yes, there is a set of people we see that they are negative, but they continue to have symptoms. So what do we do in these people? Watch for your symptoms. If they settle in 5 days, well and good. But if they don't settle, these people need to do a repeat test on the 5th day or get a CT scan done on the 5th day. Too early in the illness, if you do a CT scan, the CT scan is also going to be negative. I see a lot of people, the minute they get their RT-PCR done, they rush to do a CT scan. Please, it is not required. Wait. If your symptoms has been more than 5 days, yes, a CT scan will pick up certain changes. But not all CT will worsen. All that you need to do is go back to the previous slides that I said. Stay at home, hydrate yourself, take paracetamol and multivitamin that your doctor says, and keep watching your symptoms, monitoring your symptoms. How can I prevent the spread? This has been told n number of times, again and again, and every time you make a call, even the caller tells you, ki 2 gaj ki duri. But I don't think anybody follows this 6 feet separation. Please do not go to a crowded area. If you are sick, stay at home. If you're meeting people, always try to maintain this 6 feet distance. And masking up is very, 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 very important. If you're staying alone like me in a room right now, it's okay. You don't have to wear a mask. But if you are going to step out of your house, always wear a mask. Right now, I say, the way you don't step out of the house without a dress, please don't step out without a mask. Mask is your new trend, your new dress, your new fashion. Yes, there are a lot of fashionable masks. Please wear a mask. Any mask is good enough. Keep washing your hands repeatedly. How does mask reduce? So you can see this infographic. If somebody who's wearing a mask and there is somebody who's infected and asymptomatic and happens to cough, the person who wears a mask is definitely protected. The person who doesn't wear a mask has a maximum exposure and is likely to get the disease. If both of them are masked, the person who has a symptom and the person who doesn't have the symptom also, the chance of spreading the virus is much, much less. Trust me, there are places who habitually wear masks. If you've been to Hong Kong, Singapore, or Korea, you would see whether there's a pandemic or no pandemic, people wear masks. And that is how they've been able to curtail the virus right now. And look at the other countries. US always fought, no, we don't want to wear masks. And so is India. The cases are soaring, it's skyrocketing. So this is just an infographic saying a transmission from somebody who's masked to an unmasked to a mask is almost as much as 70%. Somebody who's masked to a healthy contact, the transmission reduces by 5%. If both of you are masked, it's as less as 1.5%. Do's and don'ts. This is something that I wanted to show you the most importantly. Do not touch your mask and bring it down to speak to somebody. Always keep your mask on. And when you are trying to remove your mask, remove it from your ears. Do not touch the front portion of it. It defeats the purpose of protection, because the minute you touch it, whatever way it would have been soiled, or if by chance you had a virus on it, you're going to take it in your hand. And I'm very sure many of us don't wash our hands. That has not changed at all. So do not pull your mask down to talk to people. Second is social distancing. See, this was way back in November 7th, 1918, when there was this Spanish flu. We had a lockdown even during that time. So how does a lockdown help? A lockdown just helps in flattening the curve. Why we need to flatten the curve? It's because of this. You're seeing that since we didn't flatten the curve, what is happening right now? We don't have hospital beds. The only bed that is yours is at home. So please stay home. Stay away from people. Only severe cases need admission. Do not let that happen. The other best way to greet each other is namaste. Don't do handshake or fist bump or anything. How to end the pandemic? One is by herd immunity. Herd immunity is everybody has to get infected, almost 80%, or by vaccination. Right now, the vaccination in India is only about 1.79 crores. And the population of India is 139 crores. Imagine when we will achieve an 85% herd immunity. Either all of them have to get the infection or all have to get vaccinated. So it's going to take a long, long time for this pandemic to end. So some few slides on the vaccine. We have a lot of vaccines in the market. Different countries are giving different vaccines. There are two vaccines that are available right now in India. One is completely Indian made, the Covaxin. The other one is the Oxford AstraZeneca vaccine, which is made by the Serum Institute and is called Covishield. So we have two vaccines made in India, and all those who have not taken above 45, for whom right now it is available, it is time you take your vaccine. Which vaccine is better than the other one? I mean, which vaccine is better? Both of them are equally effective. Both of them are equally safe. It is best to take any one, whichever is available. And the last few slides about something that is very close to my heart. There are a lot of projections. This was way back in 2020, if you see the dates. There was a projection that by June 2020, the pandemic would die out in India. There was projection on the media like the middle age would get more affected. There were a lot of messages about the number of deaths in the country. But I still feel the media projects what it wants. Now, if you see, there was something recently projected about doctors who were vaccinated got COVID. But if you see the story actually behind it, there were 37 doctors who were positive, but there were 500 other doctors in the hospital who never got infection. So the protection from the vaccine was 92.6%. And of those 37, only 5 were hospitalized. So it still was 99% effective. And out of the 5, none of them had severe disease. So it 100% protection from severe disease. But the media will always highlight what it wants. So I generally feel, the last time that I saw any media report or any WhatsApp forward was when the Italian, the military were transferring the dead bodies. That's when I decided, no, I don't need to know anything about what's happening about COVID. All that I need to know is how to treat what is coming new in the market, follow WHO or follow CDC. Nothing else. You don't need any media. So what you require to do right now is not just flatten the pandemic curve, but flatten the infodemic curve. There's so much WhatsApp messages that are transmitted, spread or whatever you want to call. Please stop it. You be the gray mark. Do not transfer it. Do not send it to anybody. We don't want to see videos of people dying. We don't want to see what is happening in Madhya Pradesh. We don't want to see what is happening in Uttar Pradesh or Maharashtra. Just make sure how you have to keep yourself safe. You don't need to know how many people are dying. Do you know how many people are getting treated? Do you know how many people are better? No, the media doesn't show you that, or your WhatsApp forward doesn't show you that. Please stop spreading any message regarding COVID on your WhatsApp. Stay away from WhatsApp. Discipline saves life. That's the only thing that you can do right now. See this child, he's so disciplined. He wears mask. He doesn't care about the rest of the thing. So make sure you always distance yourself from people. Universal masking. Don't step out without masking. Again and again, hand washing. The fourth most important is vaccination. And cough etiquette. How many of you know how to cough? I'm sure none of you would have heard this, that you're supposed to cough on your elbow. Because if you're going to cough on your hand, you're going to go and touch everything with your fingers. So the best place is to cough in your shoulder, elbow. Close to your elbow. In this place, you're not going to touch anybody. Do not spit. In India, we spit everywhere. I think at least the masking will help us from preventing people from spitting everywhere. Work from home, yes, conditions apply. If you're allowed to work from home, please stay home. If you're sick, definitely stay home. Keep your environment clean, and travel. If it is not required, please, right now, it's not the time to travel. Let's learn to live with Corona, because it is going to be there. It is going to stay with us for a while. And thank you. And the last that I want to tell you is, please stop this infodemic curve. Be aware of COVID, but beware of misinformation also. Missing information is fine, but misinformation is the most dangerous thing. So I am done with my presentation.
Ma'am?
Yes.
Ma'am, students have posted their questions in the chat box, ma'am. Shall I read it one by one?
Yes, please.
Yeah. This is from Abhisheka. As the COVID cases are rising rapidly, it's difficult to seek medical attention for each. So is there any form of medication or treatment we can follow at primary level?
I wrote in my slide, no self-medication. There will be a general physician, your family physician. Please get in touch with them. Yes, there are 2 medicines that may help you if you're not able to reach out to your family physician. One is a paracetamol. Okay, I'm sure everybody, the minute you have fever, you put on a paracetamol. Second is multivitamin. Stay at home, drink plenty of fluids. In 2 to 3 days, you should feel better. If you're not feeling better, please get in touch with the local doctor or your general physician. Please keep in touch with your general physician. It's not necessary that all of us should rush to the hospital. Most of the cases can be managed in outpatient department. You just need to find the right doctor. And as I said, 2 things you need to invest on. One is a pulse oximeter. The other one is a thermometer. I don't know how many of you understand this Tamil thing. I tell patients, arisi parpu irko illiyo, pulse oximeter and digital thermometer irkano. That is a must at the moment. So keep checking your saturation. As your saturation, that's the oxygen level. As long as the oxygen level is above 95, you can stay at home. Can we do the next question?
Yes, ma'am. Asmita Mukherjee has asked, some are saying only wearing masks and maintaining social distance is the way to eradicate the virus. Washing clothes, sanitizing goods, and all is not really necessary. Is it true?
See, you can't eradicate the virus right now. That's the wrong word. You can prevent the spread by masking and social distancing. Cleanliness, environmental cleanliness is a must. not just for COVID virus, for any virus. Right now, earlier we had this fear, it will spread via food also, it spreads via Dunzo bringing the food packets, it spreads via vegetables, it spreads in the rice and pulp in the supermarket. No, it doesn't spread via surface. All it spreads via airborne. The route is airborne. So that is why you are asked to wear a mask and maintain social distancing. Does it answer your question?
Yes, ma'am. Yes, ma'am. Next from Niveta. Can someone who's infected spread coronavirus if they don't have symptoms?
Yes, they will definitely spread. So that is why everybody is asked to mask. So these people are called asymptomatic carriers. What happens is that they just have 1 day fever or they just had some body pain and they don't realize. That is why these people are being asked to stay any symptom, just the lightest fever or the 1 day fever, just some feeling chilly, I'm feeling cold, all this kind of people need to stay alone because they may be healthy, but when they come in contact with somebody who is vulnerable, yes, the other person will get it. And right now, the virus that is mutated and we are seeing this virus, it just spreads, as I said, in 15 minutes.
Okay, ma'am. This is from Ritisha. Ventilators are being used to treat COVID-19 patients. Is it true that ventilators are life-saving in the short term, but can cause pneumonia or lung damage and more permanent harm in the long term?
Ventilators are being used because the patient is not able to get oxygen through simple measures like nasal prongs or a non-invasive ventilator. So the ventilator is being used to drive the oxygen in him. It is life-saving. Yes, every treatment has some side effects. COVID itself causes there may be some permanent lung damage. So we do not know what will happen in the long term because many people who recover, come out of the ventilator, they continue to have some respiratory discomfort or, some even land up to having a lung transplant, things like that. Not all people who are on the ventilator will end up with a permanent damage.
Thank you, ma'am. Next from Shushmita. Ma'am, will you advise teens to take up vaccine?
Yes, everybody and anybody who's but anyway, the vaccine is right now only for 18 and above. So the only two teens that can take is 18 and 19. Okay. Which is opening up in 1st of May. Please register yourself, take the vaccine because right now what we are seeing is most of the young population who are getting affected. And those who have already received their vaccine, yes, they have some partial immunity and we don't see severe illness in them. So if you're getting a vaccine, please go take it. Do not hesitate. 16th Jan, the vaccination opened. I took my vaccine on 16th Jan. First, I think when 1st March, they opened up for above 45 with comorbids and above 60. Both my parents, both my grandparents took on the first day itself. So please go take vaccine. Do not hesitate. All vaccines are safe. Please don't read the media reports.
Sure. This is from Padma. What are the expected long-term side effects of the vaccination for COVID-19? And what is considered best to eat to boost your immunity?
There are no long-term side effects. There are only effects of the vaccination. So please, this is misinformations about vaccine. Do not go through them. They will protect you. See, a vaccine will not prevent COVID-19. If you don't wear your mask, if you don't maintain social distancing, you will get the virus if you're exposed. But at least the severity of the illness is much, much lesser. You won't need, it won't be so severe that you would have to be admitted. And what is considered best to eat or boost our immunity? There is no immunity boosting food that you, like the way you receive on WhatsApp. whatever you eat at home, a healthy, balanced meal will boost your immunity. And immunity cannot be boosted in a day or so. So it's a lifetime change. So whatever you've been eating all through your year has supported you. Continue to eat well. That's it.
Okay, ma'am. Bhavani has asked, good evening, ma'am. Why is the vaccine is not effective for children below 18 years of age, ma'am?
It is not that it is not effective. We have not tested in below 18. So right now, they are not eligible for the vaccination. In fact, there are reports saying that a lactating mother, if they take the vaccine, the breast milk transfers the immunity to the child and can protect the child. But since the vaccine have not been tested in children, we are not giving it to the children. It's not effective.
Okay, ma'am. This is from Shalini. Ma'am, how long would it take to eradicate COVID from the world?
We do not know. It is going to live with us like the swine flu, which started in 2009, and we continue to have H1N1 infections. COVID will be there, but as we develop herd immunity, probably the severity and this number of cases will come down, but we will not be able to eradicate. Everybody has to be vaccinated. Polio was eradicated, smallpox was eradicated because everybody got vaccinated. So to reach that 139 crores to be vaccinated in India, you can do your maths. It's going to take a long time.
Next one. This is from Jemima. Is there any chances for recurrence of COVID in vaccinated individuals?
Yes. If you don't wear your mask, you can get COVID again. But as I said, the vaccine will reduce the severity of the illness.
Okay. Silver Soundarya has asked, even though they have vaccinated, they are getting coronavirus. What will be the reason to get?
It's the same thing, no? If you're exposed, you will get it. So understand that vaccine will not prevent you from getting corona. If you are exposed, if you don't wear your mask, if you don't maintain social distancing, you go to a crowded place, you can get COVID in this pandemic. But the severity of the illness will be much less in a person who is vaccinated.
Ma'am, can there be any other reasons other than exposure to the virus, ma'am? After vaccination? Any other reason for getting a recurrence of COVID, ma'am, after vaccination, other than
this is the only reason, because we are in a pandemic, you will get it. See, I understand what you want to say. You want to say whether the vaccination will cause COVID. No, the vaccination doesn't cause COVID. If your RT-PCR is positive, it is basically because you got the virus from somebody else. The vaccine does not cause an RT-PCR positive. Vaccine produces immunity. So it acts in a different way. So it's a dead viral particle. So it is not going to cause a RT-PCR to come positive.
Okay, thank you. Next from Priyadarshini, which method is giving accurate result for COVID tests? Is it RT-PCR or something else?
Yes, it's the RT-PCR, a real-time PCR, okay, polymerase chain reaction. Now, this is the only test that we are doing right now to detect the virus. Again, in this test, if we do too early in the illness, the test may come negative, as I said. The ideal time to do the test is any day, 3 days to 7th day after the onset of the symptom. The earlier you do, it's best. But if you turn to be negative on the 5th day also, I would recommend doing a CT scan to see if there is any lung involvement. So I just want to reach out and say, do not do CT on the first day of illness. Many of the, WhatsApp says, the minute your RT-PCR is positive, get a CT scan. A CT scan doesn't help me in my treatment plan. Okay, so the actual test for COVID is RT-PCR.
Okay, ma'am. From Vaishnavi, what's your opinion about increase in the price of Covishield, ma'am?
Who increased the price? You should ask the person who increased the Covishield price. See, everything cannot be given free. all the time. No, all that they did was they gave at a very subsidized rate. The cost of manufacturing has to be somewhere earned. No, otherwise how will they sustain? So from 250 they made it 500. That's it. So the cost of production for them is somewhere 750 to 1,000, but the government is giving you at a subsidized rate.
This question is from our principal ma'am itself. Is it mandatory to wear 2 face masks?
It's not mandatory to wear 2 face masks. You need just a single face mask which covers you properly fit on your face, not below your nose, not above your chin, or not at your chin. There is an opinion saying that if you're wearing a cloth mask, you can also wear a surgical mask. So you can wear a surgical mask. Over that, you can wear surgical mask is a triple layer, that blue color mask that you see. So you can wear that mask. Over that, you can wear your cloth mask if your cloth mask is not fitting properly. But right now, there are trendy masks. Trust me, I do that. When I'm not seeing patients, I wear trendy masks when I step out. So not required to wear 2 face masks. 1 mask is enough.
Okay. This is from Haripriya. It's told that now gastrointestinal symptoms are also seen in an affected person. Is it true?
Yes, very much. I said, no, if you have diarrhea, you have stomach upset, you have vomiting, get checked for COVID. Yes, we saw this gastrointestinal symptoms last year also, but they were not very prominent. But right now, yes, we see a lot of gastrointestinal symptoms coming up.
Okay. This is from Niveta. Is the news about vaccines leading to deaths true or not?
No. One word answer, no. You are worried about the COVID deaths or the vaccine deaths? See, don't link vaccines to death. There are so many people dying out of COVID. We are not saying that. Every vaccine, right now we are in a pandemic. So, every Food and Drug Authority is trying to, fasten up production, and a lot of trials have happened, a lot of things have happened. And this is the infodemic, this is the saddest part. We just pick on things which is not required. Have you taken the vaccine? Has your family member taken the vaccine? No, we are worried about the death, but we are not worried about the benefit that will cause you. The death would have happened only in 1 out of millions. We are worried about that one. We are not worried about the millions that are being protected. So no, my answer to your question is no.
Okay. This is from Sanchana. What can be the side effects of wearing masks and how it can be prevented?
This is so sad, no? We always talk about the side effects. We never talk about wearing masks. There's another saying, okay, there are a lot of people who will eat pani puri from the vendors on the road. But when I give a medicine, they will ask me side effect for the medicine. That pani puri never causes side effects, is it? There are no side effects of wearing a mask. The only thing of when you're not supposed to wear a mask is when you're doing a vigorous physical activity. Yes, you can develop hypoxia. Otherwise, a well-fitted mask will not cause any hypoxia or carbon dioxide toxicity, intoxication, things what you might have read, and that provoked you to ask me this question. Sanjana, you're there? I would like to talk to you.
Yes, ma'am.
Yes. So what made you ask me this question? Side effect of wearing mask.
I saw in the news, ma'am, sorry, ma'am?
See, news. Don't read news. I'm telling you. You just wear mask. Nothing will happen to you. Okay?
Fine.
If you don't wear a mask, something will happen. So don't wear a mask.
Thank you.
Yeah. Take care.
The next question is from Sanjay. Can a person with a low ERS rate take up the COVID vaccine?
What is ERS?
Probably ESR.
There's no link to ESR, CRP, anything. Please take ESR there is nothing called low ESR. ESR has to be normal, right? Less than 20 is normal ESR. So anything less than 20 or even greater than 20, please take the vaccine. There is no side effects to vaccine. There is no contraindications to vaccine right now. The only two contraindication that the government says is you're pregnant or you're lactating. The vaccines are not for those people. Anybody and everybody other than these two can take the vaccine.
Next question is from Shivagami. Is there any test specifically should be taken before vaccination?
No, please, there is no test. Please, there is no link between the CRP and the vaccination. Please just go ahead and take the vaccine.
Pooja has asked, has COVID-19 been detected in drinking water? Can it even survive or sustain in the drinking water?
No.
Okay.
No.
Next question is from Yuvashri. Ma'am, how long can the virus survive on surface?
It's all old concept. Right now, WHO says that the virus doesn't spread through surface. So don't worry about that. The virus will spread only if you talk to somebody without a mask. It's airborne, completely airborne.
Okay, ma'am. Next question is from Preeti. My question is about convincing elders because of this fake information and media treat about vaccine, they are not ready to get vaccinated and not letting us to do it. How can we convince them?
Tell PM Modi itself took the vaccine and he is doing fine. And that's why Corona didn't come to him. Tell him that.
Sure, ma'am. This is from Kritika. Can a patient with high BP take up the COVID vaccine?
Yes, please.
Okay. Moving on. Nandita Iyer has asked, is there any possibility of testing positive for COVID even after getting first dose of vaccine?
Yes. You can get COVID if you don't wear a mask. Again, I'm telling you, the vaccine will not cause a RT-PCR positive. Immediately after the vaccination, if you had an RT-PCR positive, that means either you were incubating, that's like 2 to 3 days before itself, you had met somebody and got the virus, but you did not show symptoms. Second day, you took the vaccine, and third day, it came out. That's it. Otherwise, the vaccine will not cause a positive RT-PCR. You can get infection even after the first dose, even after the second dose, you can get infection if you don't follow the 3 most important protocols.
Another question from our principal. COVID-19, is it airborne? Please give the details, doctor. Thanks for the information.
What is it?
COVID-19, is it airborne?
Yeah, it is airborne.
Please give the details, doctor.
What is I didn't get you. Please give the details. Airborne is in the sense it spreads through air. Yeah, no, I didn't get the question.
Doctor, can you just relate the humidity and the spread percentage, doctor?
There is no link between the humidity and the airborne virus. An airborne, see, the difference between a nuclear particle and say something like I would say the flu virus. Okay, the flu virus is basically a heavier virus. So we just say that you need to maintain that 2 feet distance. So the virus particles will fall down, things like that. Airborne is something like TB. It can spread in a larger area also. So right now, the concept is COVID-19 is still airborne. So it can spread in a larger area. That is why we say stop the social gathering. Somebody who's far away from me, from them also I can get if I don't wear a mask.
Thank you, doctor.
Airborne spreads at a larger distance. If the place is not well ventilated, if it's a closed indoor, yes, it spreads. So you need to have a good air circulation in that area. That is airborne.
Thank you, doctor. Thank you very much.
Thank you, ma'am.
Next question is from Swapna. Ma'am, during the first wave, children were not severely affected by COVID-19 when compared to adults. But now, with the mutated variant, more number of children are also getting severely affected. What do you think could be the reason behind this?
Swapna watches lot of TV and she watches the media very closely. Swapna, last year also we saw patients, kids getting infected, and there was this, since you have a lot of knowledge on this mutated variant, but we saw children getting infected last year also. There was this something called as MISC, which is basically multi-inflammatory syndrome. Since initially the children presented with mild symptoms, but there were children who in the follow-up, maybe 1 month, 2 months later, did present with severe illness. But right now, even now, it is the same thing. We don't see children ending up in a ventilator or things like that. It's just that the number of children getting infected has increased because this virus spreads very, very fast among family members. So if one person is infected, the entire family is infected even before that person gets tested. So that is why we see, and right now we are testing even children. So that is why you see the numbers climbing. Last year, we never tested the children. If they had symptoms, we put them at home. We said, just give them paracetamol, stay quiet. Right now, since they are testing the children, you see the numbers. That's about it. So don't worry, it's just the mutated virus that is causing infection in children. Last year also, children were getting affected. Sapna, that answers your question?
Yes.
Swapna, are you there?
Yeah, ma'am.
Yeah?
Thank you, ma'am.
Yes.
Yeah.
This is from Preeti, ma'am. Washing hands frequently won't kill the normal microflora which is present in the hands, because we have some good microbes in the hands, right?
Really? It won't kill. There are no, see, washing will only kill the flora that is stuck to your hand. So don't worry, it will not kill any good microbes in your hand.
Okay, ma'am. This is from Shakti Devi. Why people after getting vaccinated die? What precautions should be taken before or after taking up vaccine?
You mean to say patients who get vaccinated die because of the vaccine? Shakti? I didn't understand your question.
Before 24 hours after getting vaccinated, people are dying, ma'am.
How many people died and which person are you talking about?
My close friend, ma'am. Close friend's dad.
After the vaccine?
Yes, ma'am. Before 24 hours, ma'am. And another 2 peoples also I saw, ma'am. 2 more peoples.
There is no link between the vaccine and patients dying. But remember, there are, for anything, whatever it is, there will be a side effect. There will be an adverse phenomenon. There can be, there were reports of people developing clots because of a certain vaccine, but the amount of clots that develop because of COVID-19 infection is much, 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 much more than somebody developing severe clots because of vaccine. Okay, so generalizing it for the masses is the wrong thing to do right now. And what precaution can be taken? There is no precaution right now. We cannot predict who will have a side effect, who will not have a side effect. So it is too early to say anything about it. Okay?
Okay, ma'am.
Okay.
Thank you, ma'am.
This question is from Dr. Mrs. Punita Radhima. When are we likely to attain herd immunity, doctor?
Ma'am, I'm very poor in maths. That's why I took biology. But as I told you, 139 crores is the population. Right now, it's only 1.79 crores who are vaccinated. So we have to do the projection and see how many people will get vaccinated and how we develop herd immunity. So 85% of the population should be vaccinated or should have contacted the virus and developed natural immunity for us to develop this herd immunity. So 85% population means 118 crores. So it's a long, long, long time.
Okay, ma'am. This question is from Satyaprabha. How long does this vaccine hold good? Do you think we might need more booster shots?
Very intelligent question. Actually, Satya, we really do not know how long this vaccine will hold good because the virus keeps mutating. So probably in the next couple of months or next couple of next year, we may get a new vaccine. If you know something about H1N1 vaccine, every year the H1N1 vaccine is changed. I mean, the strains in that H1N1 vaccine are changed by WHO depending upon which virus is predominant in that area. And we expect the same thing for COVID. So this we do not know how long this vaccine-related immunity is going to last. We expect the vaccines to be, the viral mutations, and there will be changes in the vaccine. Yes, we may require booster doses when the new vaccines come up.
Okay. This question is from Soumya. A person who got mild symptoms. A person who got mild symptoms, can they get vaccinated at the time or to wait till the person gets recovered?
Yes, very nice questions. So yes, you have to wait till you get recovered. If you are a confirmed COVID positive person, then we recommend vaccination 4 to 6 weeks after you tested positive. But if you have taken your first dose of vaccine, then we recommend that you take your second dose 2 weeks after you recover completely from your illness. That's like you complete your schedule. Right now, Covishield is given after 4 to 6 weeks, recommended 6 to 8 weeks after the first dose. Covaxin is recommended 4 to 6 weeks after the first dose. So if somebody who has taken the first dose of Covishield, say, and they got a fever, they got COVID, say 3 or 4 weeks after the vaccination, then we recommend them to complete this schedule probably 2 or 3 weeks after they recovered from COVID. Got it? Or somebody who has never been vaccinated and got COVID, then you need to wait for 4 to 6 weeks before you get vaccinated.
Thank you, ma'am. This is from Maravili. Your opinion about Covaxin and Covishield?
Both are good. Both are same. Please take whatever is available.
Next is from Aarti. How far can contact tracing slows the spread of COVID-19 apart from other prevention methods?
Beautiful question, Aarti. But right now we cannot do contact tracing. What we do is just isolate the family who has got COVID, and we tell them, please don't step out. There's one thing that I want to tell you again is, yes, you have to test all your family members. And the biggest mistake that we do is if one of the family member is negative, especially these children who are negative, many family members take that child and put them in their tata party's house. Please don't do that. Keep the child with you. For all good reason, the child was also exposed and the child has to stay with you. One negative report from the close contact doesn't mean that they are negative. They have to stay in the same house. This is how it is spreading. It's very difficult to do contact tracing right now. So contact tracing has no role right now. Very, very difficult.
Moving on. This question is from Punitavati ma'am. Are there any other reasons that would make the oxygen saturation low?
Right now, COVID. The other thing is somebody who already has an existing cardiac problems, who had low cardiac output, or they already had some kind of congenital heart diseases, all their saturations can be low. Rendaadu vandu very elderly people. Sometimes elderly people have something called arteriosclerosis, where your vessels in the periphery, they are thickened, and so their baseline saturation itself could be 94, 95. Really very elderly. I mean to say somebody who's 80 and 89 or beyond that. And third thing, if your hands are cold, you can get low saturation, falsely low saturation. So warm up your hand and do it. Fourth, somebody who has peripheral vascular disease, your blood supply in your extremities are not good, they will have a low oxygen level. That will be picked up on the erroneously picked up on the pulse oximeter.
This question is also from Punitavati ma'am. Please enlighten us on the use of blood thinners given to some COVID patients.
See, there is a marker called D-dimer, okay? COVID per se is an inflammatory syndrome. I wouldn't say it's a infection, okay? Like for which you need to give, like some bacterial infections and you give antibiotics and things like that. COVID is more of an inflammatory syndrome. There is always a difference between inflammation and infection. So what happens in COVID is the inflammatory markers go up. That's like you might have seen people doing something called CRP, D-dimer, IL-6, and all those things. Now, D-dimer is something which predicts, studies have said that COVID increases your chance of clotting in the body. So D-dimer is a marker for this clotting activity. So when the D-dimer is high, there is a value, some greater than 2, okay? Greater than 2 on that, SI unit, okay, the values, then you need a special blood thinner, what we call as an anticoagulant. I choose something between 1 to 2 where I give patients blood thinners to prevent this clotting happening. So D-dimer is a marker for clotting, an inflammatory marker in COVID. Ma'am, does it answer your question?
Yes, ma'am. Thank you, ma'am. This question is from Anusha, ma'am.
Okay, the
vaccines
last
produced
question, and we will stop with that. Huh?
Yes,
Okay.
ma'am. Yes, ma'am. Only one more. Are vaccines produced by different countries to be used in accordance to the geographical distribution, since genetic shift or drift vary in geographical natures?
Very beautiful question. See, the thing why they are used in that geographical distribution is there are certain vaccines which need certain temperatures to be temperature for storing them. Like your Pfizer vaccine and the Moderna vaccine, they need temperature less than -30 and -20 to be kept. And for India, we cannot maintain that temperature. So that is why certain vaccines are not available in India. And we're using vaccines which can be stored in the Indian climate type. So that is why in COVID, so many different vaccines. There is nothing to do with the genetic shift or drift in COVID right now. This shift and drift we talk in flu vaccines. But flu vaccines, yes, we have 2 different types for the southern hemisphere and the northern hemisphere. That is picked up by the WHO on the prevailing viral strains that are there. So for COVID, it is only because of the temperature that is required for storage of these vaccines.
Okay, ma'am. The last question is from Yuvashri. Ma'am, one of my friend and her family, except her sister, got COVID positive. How is it possible when everyone is living in the same house?
Yuvashri, yes, it is possible because the RT-PCR will pick up only 60%. There are still 40% which may be missed on that RT-PCR. Second, probably it was too early in our illness and so it missed out. Third, maybe the method in which it was done in her was wrong. The collection was not adequate, so it was negative. If she has symptoms and she's been living with them, it is possible for her to be falsely negative, or yes, she's truly negative because she followed masking very religiously. Does that answer your question? So she's the example for wearing masks in the house. Yuvashri.
Yes, ma'am. Thank you, ma'am.
Okay.
Thank you for your patient answering. You have cleared all our doubts about vaccine.
Yes.
COVID.
So one request to you all is one, please stop the infodemic. Reach out to the doctor if you have any symptom, get tested and isolate yourself. And wear a mask every time you step out of the house. Will you all do that? I think you can all unmute yourself and tell me one yes. So that would be very satisfying.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Thank you so much for patiently listening. Thank you so much for patiently listening.
One more time. Yes, doctor. Just a vote of thanks from a student for you. It's a few minutes. Please, thank you.
Yes.
Aishwarya?
Yes, ma'am. A warm and a grateful evening to one and all gathered here. It's a privilege to propose a vote of thanks on this occasion. On behalf of Etishakti, I would like to thank our chairperson, Mrs. Chandra Devi Telagachalam, our principal, Dr. Tirumadi S. Kodai, the vice principals, Dr. Mrs. Usha Rani aided, and Dr. Mrs. Usha Priya self-supporting for gracing this event with their presence. I also like to thank our chief guest and resource person, Dr. Madhumita, for enlightening speech on the pandemic and really grateful for accepting our invitation despite a busy schedule. Our sincere thanks to the Dean of Students, Dr. Ms. P. Punitavati aided, Dr. Ms. Anusha Balasingh self-supporting, and we get Dr. Ms. Ganga and Satya Prabha for arranging this resourceful session, and Ms. Yamini for a technical support. Etishakti could be incomplete without the other lead faculty in charges, Ms. Radhika, Ms. Grace, Ms. Tilagavadi, and Ms. Archana. And finally, I would like to thank all participants for showing the interest which lead to the success of the webinar. Thank you.
Thank you so much. Namaste.
Thank you, ma'am. Thank you for this enlightening session and so patiently answering all the questions, the students as well as the faculty. Thank you so much, ma'am.
It's my pleasure. That's what I said. Right now, disseminating the right information is the best way to fight COVID.
Thank you, Dr. Madhumita. Thank you very much.
Thank you very much, ma'am. Thank you. Stay safe. Take care. Keep yourself masked.
Yes, ma'am. Thank you.
Bye-bye. Take care.